I think I have some guests who actually can't make it because they're sick. So you all have a big room to yourself. So first of all, I would welcome all of you to celebrate this Shiro, this International Women's Day topic today. Before we dive into today's exciting program, I just want to take a moment to acknowledge all the amazing Shiros in this room. Okay, we are all doctors, mothers, professionals, homemaker, and many more, right? So we wear many hats, and today we celebrate them all. Okay, but International Women's Day isn't just about acknowledging your accomplishment. It's also about growth and empowerment. So today we'll be focusing on health and beauty. We will learn how to take care of ourselves, both inside and out. So today, first of all, we'll have Julie Low, senior physician from Oriental Remedies Clinic, TCM for fertility. That's the first topic. So I'll hand over to Julie.
Hi, thank you for coming. Good afternoon, everyone. I'm actually glancing around, right? I see people of all ages. Okay, so we have younger and older individuals lah. But just can I have a show of hands, right? Other than the young people in the group, right? For probably the ladies over here, do you have children of your own? Yes. Do you have grandchildren of your own? You do. So are they in any stage or whereby they want to have kids? Or all are done? Close factory already, yeah. Okay. But anyway, since my topic is about TCM for fertility and sexual health, it may or may not match with whatever you are at your life stage. But I'm just going to share. Hello. Yeah, but I'm just going to share with all of you a little bit more about how TCM views fertility as well as sexual health. Any questions, you can ask along the way or at the end of the talk, okay? So let me do some self-introduction over here. My name is Julie. I'm a senior physician at Oriental Remedies Group. I've been in the line for, I think this year is my 10th year mark. So I graduated from NTU, Biomedical Science and TCM. So today my topic everyone can see the font, right? Okay, so today my topic, firstly I'll cover what is the concept of sexual health and fertility. And also in TCM, how do we view fertility and sexual health? And also how can TCM help? So before that, right, let me share a story with all of you. Okay, last time, I used to intern in China 10 years back before I graduate. So at that point of time when I was interning at the gynecological department in Beijing, there are actually many couples who seek TCM help for female health, whether they are at the stage of their period, menopause, or even couples of fertility. So a lot of questions come in my brain when I was studying TCM. So why is it that sometimes patients may go for various checks, hormone checks, ultrasounds, blood tests and everything turns out normal? Yeah, so why is it that when people still have period-related issues, people still have issues or problems conceiving? Okay, sorry, I'll continue. Yeah, why do they still have issues conceiving? So 10 years later, after I have seen patients of my own, I do realize that actually for health, right, it encompasses many phases. So what we are talking about when it involves blood tests and ultrasounds, etc., all these are more physical signs, correct? But TCM, we focus a lot more on holistic health, which means other than the physical portion, the mental, how do they feel, and also the physiological being. This one are things that we often look up for, and also during consultation, we will ask a series of questions to understand the patient on a personal level so that we are able to know what's their body constitution. Okay, so before I talk about the content, let's take a look at the definition. What does sexual health mean? So can I have a show of hands, right? Do you all know what sexual health means? Okay. So are you able to share, in your perspective, what is sexual health? All there. Okay. Yeah. So maybe many people, right, do not know that there's a WHO definition of what sexual health is. It is actually a state of physical, emotional, mental, and social well-being. So it's actually more of a holistic well-being of the person. So not only about medical and reproductive issues, actually nowadays when mental health is a very important topic, right, in younger or even older individuals, right? Yeah, so the sexual health or even holistic health, right, is something that people often look up to. Give me a moment, Do you want it? Okay, sorry, do mind. Okay. Yeah. Yep. It's okay. It's okay. Can. Okay, what was I? Okay, when I was talking about the about health, right? When we talk about the holistic well-being of that person as a whole. Okay, and this is actually in line with when we view infertility or fertility. By definition, right, fertility means that when couples they get married, right, and they have unprotected sexual intercourse, and there's a failure to achieve clinical pregnancy after 12 months of trying. Yeah, so some people are very conservative about the word. We usually use the word baby dance. Okay, so yeah, so technically speaking, with unprotected sex, if there's a failure of achieve pregnancy, we classify it as infertility. Of course, there can be many reasons we'll share later. Yeah, and either the partner of yourself above the age of 35 have been trying for more than 6 months without success. This one is also classified under infertility. So how does TCM or modern medicine view infertility? So actually, if you look at it, we have modern medicine as well as the TCM. So in modern medicine, age plays a very important factor, and there's actually statistics that show that above the year of 36 years old, the chances of conceiving naturally is actually half of a person who is probably 20 years old. Okay, so when we age, actually the chances of conceiving naturally declines. Of course, now there's a lot of modern technologies, right, that can actually enable conceiving to happen at a later stage in life, especially nowadays when people form a family at a later stage, right? Yeah, but age plays an important factor. And hormonal imbalances as well. Structural issues, any issues pertaining to the uterus, the ovaries, or for male, the sperm quality. And of course, nutrition and lifestyle, the kind of things that you eat. So this one coincides with whatever TCM believes in, nutrition and lifestyle as well. So diet, the things that you eat. So when, can I have a show of hands, right? Who has seen TCM yourself before? Only, okay, I have 3, 4 out of the whole room. So, sorry, yeah, 4 out of the whole room, right? So have you ever been nagged by a TCM physician? Don't eat this, don't eat that, cannot drink cold drinks, can you not eat fried food, right? Okay, so these are things that mothers tell their children, but same thing, when we visit a TCM practitioners, that are the things that we always say. So pertaining to fertility, there are certain kinds of diet, right, that we always advise patients not to take, okay? And also because nowadays, right, the things that we eat, some are processed, some probably are, there are potential phytoestrogens inside, because we take a lot of things that has plastics on it, right? Yeah, so takeaway food is one of the examples that we often advise patients not to take too much of. Okay, so hormonal imbalances and structural is the same, and of course lifestyle. So supposedly one person, right, for our age range, we are supposed to sleep 6 to 8 hours every night, right? But can I ask who sleep lesser than 6 hours in the room? All very healthy, 8 hours? 8 hours, more than 8 hours. Oh, wow, very good, very good. Okay, this is the ideal lifestyle that we all want for. 6 hours. You sleep for 26 hours. You sleep for 26 hours a day, but there's 24 hours in a day. Oh, okay. Oh. Okay, yeah, but ample rest is something that we actually focus on as part of the TCM, because why is it so, right? It's because, right, we often focus on the yin-yang balance in our body, and sleeping by itself, right, actually helps in terms of securing the yin in our body, which is actually very important for fertility. Of course, fundamentally, traditional Chinese medicine, we focus a lot on body constitution. So when you see a TCM, for those who don't know, right, because I have many in the room who may not be exposed to TCM, we often look at the tongue. Yeah, so patients, usually when you enter the room, we will ask a series of questions, inclusive of lifestyle, inclusive of period, inclusive of your main concern. And to these questions, right, will bring us to a conclusion, which is your body constitution. And that is how, right, we know how to treat a particular patient. Okay, so pertaining to fertility, these are the more common body constitution seen. Female, it involves cold womb. For male, it is more kidney deficiency as well as blood stagnation. For those of you who may not be familiar with the terminology, it's okay. I'm going to share some symptoms. Okay, I understand that currently in the room, right, not all of us may still have our menstruation period. Yeah, but those who have, or those who have kids or even grandkids who are having that period, good indicator, right, to know whether a person has a cold womb or not. Yeah, so why am I touching on cold womb, right? It is also because cold womb is one of the most common reasons why a female may find conceiving hard. Okay, so how do we identify whether you have cold womb? So a very simple check, right? It may or may not be 100% reliable. However, the most simple check, right, is when we get all of you, you can feel the temperature of your chest. Okay, not outside the clothes lah, just inside lah. You just touch the temperature of your chest. So this one is a net body temperature, right? The next moment, you can use the same hand and touch your lower belly. Okay, not over the clothes, it is inside. You can touch the skin. Yeah, then it can potentially be that your body constitution is on the colder side. Yeah, so if there is a difference in temperature, right, and you find that the lower belly, right, is actually significantly colder as compared to the rest of the body, you can potentially be part of a cold womb syndrome. How do you know whether you have? Other than looking, other than feeling, through a person's period, you will also be able to identify whether you have cold womb syndrome. Okay, for those of you who are still having a period, is it bright red or dark red? Okay, so I know that it's a very sensitive topic. No one is very convenient to share, but for bright red menstrual flow, right, it's considered a normal color. So supposedly a normal period lasts for 5 to 7 days. Starts off with a heavy bright red color. After that, it will taper off with slightly darker red color. This one is considered normal. Yeah. So if one, right, experience period, right, that is consistently dark with potential blood clots, and you even experience painful menstruation, this one you may belong to the cold womb syndrome category. Other physical symptoms involve cramps, lower belly hurts after every period, or maybe when you see a family member who's there and said, I'm not feeling well, my heel feels very painful, I'm having my period. Potentially it may belong to the cold womb syndrome. Or this is very common nowadays, cysts and fibroids in the female organs. This one is actually uniform across all ages, irregardless whether you are at the childbearing age, or that it is after menopause. But usually after menopause, the uterus will actually shrink. So this one may not be that common. Okay, cold hands and feet. Or you have cramps, and when you put something hot on top of your belly, you feel better. Lower back pain, you pee a lot at night. And we use basal body temperature to actually track the cold womb also. There's a slow rising or early declining basal body temperature. That means that you have a cold womb. So do you actually know, as in, is cold womb only important, right, for those who want to have children? Okay, no. Yeah, I think most of you, most of us are women, right? We know that having a cold womb, right, it is not only important for people who are having children, right? It is actually important for every woman. So why is it so? Because, right, other than cold womb making conceiving hard, right, not so ideal for the fetus to develop, right? Actually, it is the symptoms that is tied to the cold womb, right, that we will want to help with, or we will want to treat. Okay? Because who likes pain, right? No one actually likes pain, right? So what can be the potential reasons? Just now we talked about lifestyle and diet, right, that may affect or increase the occurrence of cold womb syndrome. Number one is taking cold drinks and salad. So can I have also check in, right? How many of you take warm things on a regular basis? Okay, 1, 2, 3. Okay, so say 3 people out of the whole room, it is around maybe, I don't know, 20% who take warm things on a regular basis. Okay. To be honest, I myself used to drink cold drinks also until I take TCM. And when I see my teacher tell me my body constitution is so bad. So I stopped taking after that. That was many years back. Okay. Yeah. So taking cold drinks, right? One misconception people will have, right, is that taking cold drinks are not good. It causes cold womb. But taking cooling things, right, it also causes cold womb. Yeah. So what do I mean by cooling things? Things like too much of maybe your coconut water, too much of watermelon, too much of green bean soup. It is warm, right? But because its nature is cooling, taking too much of it, right, it is also not so good for the body. And salad. Yeah, I think a couple of us, right, who are on the diet occasionally like to take salads, correct? Some yes, some no. Yeah, so salads, right, are actually also considered cold for the womb. Yeah, for women who want to go for a diet, we usually recommend cooked vegetables. Okay? And also chemicals. We are living in a life whereby we are exposed to chemicals on a daily basis. So what are the more common chemicals that y'all can identify around you? Bleach. Okay. What else? Vinegar. Vinegar not considered chemical. Vinegar can drink. Detergents. Perfume, yeah. Yeah, actually, I will say that everything around you, right, modern lifestyle, right, we can't exactly avoid. Just like last time, right, I have a TCM teacher who tell me, right, we are living in an environment, modern environment, whereby we can't avoid all those chemicals, right. The only way we can do, right, to prevent, right, is to take a little of everything. So, yeah, so we can actually make our life longer. Yeah, but anyway, constant exposure of chemicals can actually result in our body constitution to be not that ideal for conceiving as well. Okay, so if you are concerned about conceiving, or you have anyone around you who are concerned about conceiving, now we are in a generation whereby we understand the nature of conceiving not only involves the females only. It takes 2 hands to clap. Okay, all people who are trying, right, couples who are trying, it involves the health of both the women as well as the men. Okay, of course, trying couples, if you manage to perform the baby dance successfully, then the conceiving can happen. But it is unsuccessful. There are actually statistics that show that up to 40% of the childlessness has a male origin. So that's why when patients come to our clinic, right, for example, few years back, I have a patient, a lady who come in for consultation for fertility concerns. So actually, she also have some health conditions and some blood test abnormalities. Yeah, so after tuning for a while, her condition is actually quite stable. However, the pregnancy didn't happen. So at the point of time, I actually get her husband to come in for treatment as well. So the husband actually tuned his body at the same time together with the wife as well. And after 2 months of tuning, actually they managed to have a child through natural conceiving. So most of the time when patients come to our clinic, right, we recommend the couples to tune their body together. Okay, I'll continue. So how to improve your body, irregardless whether it is for sexual health or or that you want to make yourself more fertile. First is through TCM. Of course, proper diagnosis is very important. Second is good nutrition lifestyle. Then next, I will share with you some acupressure and acupoints for you to massage on a regular basis, right, to help in terms of female or male health. Okay, I will roughly share with you about a little bit more about the treatment protocol that we have in our clinic. Okay, so of course, many people can come from different stages of life, correct? You can be exploring. That means that there are no checks being done. What you want is just to tune your body to help you to help the couple conceive better, or that they are actually there's actually a time frame tag to them. That means they are due for IUI or IVF. There are specific activities that we will get the patients to observe. So for example, right, if you are at the exploring stage, can see, right? Okay, we will get patients to actually observe their own menstrual cycle. For some, we will track the BPT and the cervical mucus. Then after that, for those who are trying naturally, if there's irregular, then we will spend around 3 to 6 months to tune that period first before we get them to start trying. Okay, then or that if they are trying naturally and after 3 months there is no successful pregnancy, we'll get them to do a blood test or do further checkups to check if there's anything wrong with the structurally or hormones. Okay, for those who are who already have IUI and IVF checks or due date, right? Then what TCM does, right, is to actually adhere to the timeline given and also provide the treatment accordingly. Okay. So how TCM can help in terms of different needs, right? Actually, fundamentally, right, first is to identify their body constitution, and also, of course, what we do, right, is actually to ensure that there's sufficient blood flow to the womb. Make sure that circulation is okay. Make sure that the womb is warm enough for impregnation to happen. So today I'm going to share a very simple drink or soup, right, that you can cook at home. Can I check nowadays, anyone of you have drank Tang before? 1, 2. Okay, does it taste good? Huh? Your mom advised you to drink more. So now, yeah, it's good to drink more. Yeah, my mom also advised me to drink more. Next time, I'll tell my kids to drink more as well. Okay, so Tang is a very common TCM herbal tonic soup, right? That is, number one, it tastes good. Okay, because a lot of our patients, when they come to the clinic, they'll say, "Eh ya, 医师你的药很苦啊," like, or doctor, because your medicine so bitter. So this one is one of the few herbs, right? It's one of the few tonics, right, that is pleasing to the tongue. Okay, and at the same time, right, it is a very useful tonic, right, to help to nourish the qi and the blood both at the same time. So it involves herbs such as Tang, Fuling, Poria, as well as Bai Shao. Tang itself can help to nourish the blood, also helps in terms of circulation. Fuling itself can help to calm the mind for those who are very stressful, right, either preparing for kids or they have menstrual irregularities that requires the stress level to be a bit lower. Fuling can help. And Bai Shao is to tonify our liver. Okay, so why is it that tonifying the liver is very important nowadays? Is because in Singapore, our lifestyle, it is actually quite stressful. Yeah, so Bai Shao is a very good herb, right, that can help to regulate the liver and also help in terms of stress. So look at the very nice tasting herb on the right. This is how the Tang look like. It looks black, but it tastes good. Okay, so next, acupuncture. So other than taking TCM herbs, right, acupuncture is also a very good way in terms of regulating the hormone levels. Either for those who have irregularities in their hormones based on their blood test, or that we want to regulate the menstrual cycle leading up to them having a natural conceiving. Acupuncture can help in terms of increasing the blood circulation, regulating the hormones, and to relieve stress. So secrete the right hormones at the right time in the women's cycle. Usually in TCM, we divide into 2 areas, before and after ovulation. Before ovulation, we actually nourish the yin of the body, But after ovulation, we nourish the yang of the body. Okay, so yin is it's about more about blood, and yang is actually more about qi. Okay, so now it's activity time. Okay, I'm going to share with you some acupoints that you can do to help yourself in terms of tonifying your liver, spleen, as well as kidneys. This one, right, is good for people who, couples who want to have children. You can use it for males and females alike. Okay, even for the elderly over here, it is also, these acupoints are actually very safe acupoints to use also. So, shall we do some practice now? But those who are wearing shoes, maybe have to take off your shoes. Okay, I need a model. Okay, I'm going to share the acupoints one by one. You can help yourself by massaging, or those of you who need people to help you massage, you can raise your hands. Okay, so first acupoint is actually called Tai Si. Tai Si is kidney tree. So the acupoint itself, right, is actually very important, right, for nourishing the kidneys, which we view as a very important organ, right, to help in terms of sexual health and fertility. So where is Tai Si? First, we need to identify where is the inner part of the ankle. For those of you who can see, I need you to. Okay, for those of you who can see, you can stand up. Okay, yeah. So first, locate your inner part of the ankle. Okay, second, locate your heel at the back. It is the Achilles tendon at the back. So Tai Si is actually in the middle. Okay, between, at the back of the ankles. Okay, so based on my colleague's face, you know that it's very sore. Okay? Yes, correct. So for those of you who are pressing, you can raise your hands. I can help you check whether it's correct. Yes. Yeah. It does hurt. Let me help you with it.
The way you press it will hurt. Everything will hurt.
Okay, can. Okay. Yeah, so you're supposed to actually press it down, and massage it in clockwise to help in terms of nourishing. So clockwise usually correspond to nourishing. Okay, so since we want to nourish the kidney, and also, right, based on ancient classics, right, Tai Si is a point, right, whereby the blood, right, and the yin, right, is the most abundant. Yeah, so actually, as a nourishing Tai Si, right, can not only tonify our kidneys and also help in terms of nourishing the blood in at the same time. Okay, that was the Tai Si. Second point is called San Yin Jiao. You can see on the diagram, right, San Yin Jiao is actually a little bit higher than Tai Si. So what you have to do, right, is to put 4 fingers, right on top of the inner part of the ankle. Use your own 4 fingers. So Tai Si, the point is actually above. Right above, 4 fingers up, right behind the bone. This one is actually called San Yin Jiao. San Yin Jiao. Yeah. San Yin Jiao is also called SP6. So San Yin Jiao is actually a point, right, whereby we can help to regulate the spleen, liver, and kidneys. So for those who don't understand or may not have a lot of exposure about TCM, right, spleen, right, it is actually the organ, right, that produces the qi and the blood. And also liver, right, is the one that can help to regulate our emotions. So those of you who feel stressed or feel very irritable, so liver is a very important organ that we need to regulate. And of course the kidneys, the fundamental for sexual health and fertility, this one is very important also. Okay, this one is San Yin Jiao. And next is Tai Chong. So Tai Chong, Tai Chong, where is it? So locate the top of the legs, right? It is actually right between the big toe and the second toe. Yeah, so Tai Chong, right, is a liver regulating point. In lymphatic health, right, we also correlate it to the flush point of the lymphatic system. Okay, so a lot of times, right, when patients do acupuncture, especially right when they're undergoing the IVF and IUI process, we often use this point. Why is it so? when they started injecting large amount of hormones into the body, right? Actually, it can make one person feel very stressed because of the bloating. Yeah, so, and also some may actually experience insomnia as well. So this is a very good point. It's a stress reliever. Okay, thank you, thank you. Yes. 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 Yes, it's all on the inner part of the leg. Yeah. Why do we stimulate the inner part of the leg, right? It is because in terms of fertility or female health, right, we focus a lot in nourishing the yin. And usually yin points are on the inner part of the body, inner part of the legs, and also the inner part of the hands. Mm-hmm. Mm-hmm. Okay, can. SP6, you imagine this one is the ankle. I think because there's no graphics of the ankle over here. So imagine the inner part of the ankle is over here. We put 4 fingers up this way. So when we put full 4 fingers up, right, we are able to feel the bone here, right? Which is the tibia. The tibia bone is a very, very big bone. So Asaninja is actually right behind the bone. Okay, right behind the bone. So technically when you press it down, right, you are pressing right beside the bone. Yes. Yeah, you just put 4 fingers on the inner ankle. Yeah. So the Saninja is above the hand. My colleague will help you with it. If there's no pain, it is either your pain threshold is high, or if you want, I can help you with it. Okay, I will move on. Yeah, the diagram may not be 100% accurate, but it's right inside of the ankle. Okay. Okay. In our clinic, in Oriental Remedies, we provide TCM-related treatment. And we often, we actually also have 2 tech therapies. Yeah, so the intention of the tech therapies, right, will actually help in terms of enhancing the circulation and also help nourishing the body at a more efficient rate. So one of the treatment that we have is called ELT, which is electrolymphatic therapy, focused in terms of enhancing and improving the lymphatic system in the body. So we often couple this, right, to help in terms of female health patients, right, to establish the lymphatic circulation, which can also help in terms of the blood circulation inside the body. So rule of thumb, right, when patients come in for fertility concerns, we often do the ELT before ovulation so that we can improve the circulation around the body, especially to the womb. Okay, so for females wise, it can help in terms of maintaining a healthy womb and uterus lining because of the circulation. And also, right, it can reduce chances of any form of like infection and also regulation of stress. So can males also do ELT? Of course, because it is a treatment that can help in terms of overall circulation. So for males wise, right, it can actually help in terms of overall immunity and also circulation, right, to the bottom. Specific for males, right, since today the topic is very female-centric, so for males wise, right, currently one of the key reasons, right, why is it that sperm quality may be impacted, right, it is also because of oxidative stress, and there are actually research papers, right, that show, right, that oxidative stress, right, can be detrimental to sperm quality and sperm health. Yeah, so that is also why, right, not only for females, right, for males wise, right, you need to ensure that the overall circulation is good. And also, of course, we need to reduce the oxidative stress to the body. Okay, so this is just an overview for those of you who have, who you yourself or your family are interested in terms of the treatment protocol. This one is the treatment frequency that we have, right, in the clinic to help in terms of female health. Okay, any lifestyle tips? Okay. This one, right, is lifestyle tips to help in terms of successful pregnancy. We always like to couple with Western checks, which means they probably, for those, right, who have not done any fertility checks before, and also they've been trying actively for 1 year, most of the time we'll also let patients, right, do prior fertility checks first before seeking TCM care. Reason being, right, it will save a bit of time because a lot of people come with a specific timeline, so it will save a bit of time, right, when we can identify what is the underlying root cause of any condition. Stop contraceptives for preparing for pregnancy, and also drinking, smoking, and caffeine have to be reduced. This one, right, is for general health, right, not only when one is preparing for pregnancy. And also for people who are preparing for pregnancy is to consume folic acid. Yeah, exercise is very important and de-stress. Okay, for those who are interested or you have loved ones who are interested in fertility concerns, right, we actually have a fertility ebook. It is a very detailed, very concise ebook, right, that actually writes the different stages of fertility, and also, right, in what stage, right, what are the treatments and what are the things that you can take note of. If you are interested, right, you can scan the QR code and also have a good read. Do spend some time to digest because internally, right, this is done by all the physicians in our team, and it has very, very detailed information of like what to look out for. Okay, those who need more time to scan, you can let me know. No. Okay, otherwise I'll end my talk for today. Thank you very much for your time. So do I hand over now?
urinary health. Okay, so next up we have Dr. Fiona.
Before we start, thank you for coming. Thank you for joining us on a nice Saturday afternoon. The weather is very hot. I hope everybody drink enough water.
Testing. Okay, I think this works.
Yeah, thank you. Most people, if you can survive not going to the toilet, right, throughout the whole session, right, I think you're good. Okay. Okay. Is your pointer? Or click on it. Okay. So today I'm going to talk about a topic that is not so commonly seen, but yet a lot of people have the issue. Huh? Okay. It's about bladder pain syndrome. Most of the time we see in the females, but of course it's possible to have it in the guys as well. Okay, although not so common. Yeah, I start. let's have a chat first, okay? Okay, if you're wondering, right, what my clinic name means, right, it's actually, right, it's actually pronounced as R. Basically, it's a river in Switzerland, okay, where I train postgraduate. I did some postgraduate training there. So this river, right, it's nice. It runs through. I think everybody's urination should be that. Okay? Flow nicely like a river, don't get blocked, no pain, smooth. That's the best kind of urination. But unfortunately, right, as we get older, right, all of us will have a little bit of problem. You don't have to be very old, right, to have bladder problems, to be fair. Even young people nowadays, I see more and more. It can be due to various reasons. But I think the important thing, right, is to get treated early. Because if it festers on, right, nothing good will come out of it. It will just get so bad. And, there's actually a lot of suffering. A lot of people don't understand that actually we pee a lot of times. I mean, we pee every day. Okay? We take it for granted that it's going to be normal. And then when things don't get normal, people are like, why like that? Or they think that it's part of aging, they don't care. That's not true. Okay? The slides are up. Okay. So we do some simple discussion first. A lot of people like to ask this question, what is normal urination? Okay? Normal urination from this slide you can see, on the extreme left, right, is very good lah. Okay? Very well hydrated. It's very tough to be transparent. So don't aim for transparency. Okay? It doesn't happen. On the left, right, is a light yellow is very good already. Then you look at the whole spectrum. On the right is very severely dehydrated. Okay? In the morning, right, it tends to look somewhere in between. Okay? Your urine is a bit concentrated. That's also normal. Because when you sleep, you don't wake up, right? Your kidneys are actually still working, A lot of people also don't realize that actually their kidneys, all our organs work very hard, Okay? Because when you're sleeping, right, our heart is pumping, If not, we cannot wake up already. Then the bladder, the bladder is storing urine. The kidneys are still producing urine. It's doing its job. So that's the gist of it. So in the morning, right, it will be somewhere in between this chart. That's good. Okay? Don't get onto the right-hand side. That's when you didn't drink water for various reasons. Like for younger people, they go mountain climbing or whatever, right? Then you will really see their urine as on the right side. It's very dehydrated. Don't get there. Okay? So this is what we discussed just now. Then the urine, right, the last two, right, dark brown and red and bloody are the most abnormal. Okay? Dark brown urine is also nothing very good already. When there's very severe liver condition, the urine actually turn brown. Okay? Kidney, possible, but not so common. Recently, right, in the newspapers, there's always those articles on, the young ladies, they go for their spin class, right? So when they go for spin class, right, I think they're also not used to exercising so much in a short period of time. So the muscles die. When muscles die, right, there's so much toxins released, right, that it actually affects the kidney. Then that's when the urine turn brown. And then, of course, being young people, right, they recover quite well if they hydrate, go to the hospital and stay. But somehow, I think the kidney has taken a hit. Because after that, when we test it, right, I saw some patients, then when we test it, the urine still got a little bit of blood. That's not so normal. So don't do that again. Okay? Then red and bloody urine. Red and bloody urine, it can range from something that is totally quite okay, like UTI, a lot of pain, after that resolve, to something as bad as kidney cancer and bladder cancer. It's very insidious one. So when there's bloody urine, right, and no pain, right, then please see a doctor. Okay, no pain, again, is nothing good. It's even more serious than got pain. Okay, but of course, got pain is what, when patients have pain, they seek treatment quite fast. Without pain, everybody just push up, wait, until it happens again. Because I have patients who had months of bleeding, but they didn't see any doctor until it's quite bad. Okay? Okay. These are the cloudy urine, cloudy and brown urine that we're discussing. And this is usually what we see. But of course, sometimes we are not sure what kind of bleeding it is. For the female, sometimes we are still menstruating, right? Then it can be menstrual blood. For the guys, it's quite obvious, unless they're sitting down to poop, and then it may be from the pulse or something like that. Otherwise, when you see blood like that, then please see a doctor. Okay, what do we do? The most common one, we do a urine dipstick. Okay, in the GP, in the polyclinic, right? The most common test is dipstick. Dipstick is quite sensitive. So if there are some abnormalities of dipstick, we are quite sure there are some issues already. Of course, it can be contaminated. For the female, sometimes when they're having menses, or when they have vaginal discharge, right, the dipstick will have some abnormalities. So most of the time we do repeat the test to make sure it's all good. Then urine culture is very important because when patients have UTI, especially chronic UTI, have it again and again, they get treated in multiple causes of antibiotics. But I think most importantly, we need to isolate the bacteria. We isolate the bacteria so that we actually can target the antibiotics towards the bacteria. Otherwise, right, later on we go through this topic called bladder pain, right, a lot of people will get treated non-stop with antibiotics, Actually, they don't really have an infection anymore. It's pure inflammation. Okay? Then in the urine, we also test for red blood cells, white blood cells. Okay, these are the main tests that we do. These are the very common problems that we see in men and women. So for men, right, they're more prone to stones. Okay, prostate only men have, so only they have issues. Urinary tract infections, the females, they have it more common. Why? Because their urethra is shorter. And also, right, because of that, our urethra, right, is actually nearer to the anus. So everything is in more close proximity as compared to the guys. Because guys, everything is externalized, so it's actually not so bad. Okay? But we take guys' infection more seriously. Because when they have infection, it's really a problem already. Yeah. Okay, incontinence, female more common, but guys may also have it. Okay? So we talk about this entity called chronic pelvic pain or bladder pain syndrome. Okay, so chronic bladder pain, right, usually they will say, I have this very bad pressure, right, in the bladder region, the suprapubic. When you touch your lower part of the abdomen, you will feel a bone. So above the bone, that's a suprapubic region. Okay, then they have already done whatever they could already. See doctor, CGP, took multiple courses of antibiotics, and it still continue to last, more than 6 weeks. Yeah. Then of course, a lot of people, when they read the brochures or they go on internet and surf, right, they like to come for this and tell me they have this entity called interstitial cystitis. Interstitial cystitis is a very, very specific condition. It's very bad inflammation of the bladder. They cannot hold their pee at all. They go toilet every 10-15 minutes. This is the very 严重 kind already. It's the other spectrum already. Okay? Most people, fortunately, don't have this. But the problem is if we leave conditions long enough, sometimes they do progress to this, And it's very, very, terrible. For short, a better term for the patient. Because it's very, very painful. They can't even function day to day. It's quite chum. Yeah. Then some of these patients, they actually have other conditions. Fibromyalgia is a condition where they have a lot of body pain. Okay? Then most of the time when they have this condition, people, doctors or whoever, they tend to be very dismissive. But it's not it's a condition. Okay? All of us got body ache that's quite okay. But if it's so bad that you cannot even get out of bed, then please get it checked already. Then chronic fatigue syndrome. A lot of patients, because they're very kanchiong, their personality is kanchiong. They also got irritable bowel. Okay, then they also feel urgent, want to go toilet, want to pee and poo at the same time. Okay, sometimes I tell them after treatment, you also have to learn how to relax. You cannot live your life in a kanchiong state, because it's actually very bad for health. Yeah. Okay, then other patients, sometimes they don't have the suprapubic pain, but they got pain, right, at the private part there. For the females, right, it's very near the vagina also. Or some of them, the guys describe it as a very deep pain, just behind the testes. Yeah. Then, yes. So it can cause a lot of distress and quality of life is really affected. And for this chronic bladder pain syndrome, right, they have to go toilet very often. So if they are students, right, they find it very hard to concentrate in school. At work, right, I have one patient who needs to go every 20 minutes. So at work, right, somehow it affects their life. They cannot work for long. Yeah. Okay, so as today's topic, right, about fertility and stuff, right? So how does it affect the females? A lot of people also have coincidental menstrual problem. Maybe they think it's normal. Maybe they think menstrual cramp every month is normal. But when the cramp is so bad, right, that you cannot function without painkiller, that's not normal already. Or you are sweating away in pain, or you need to take MC, it's not normal. There's this condition that's called endometriosis. It's actually a condition whereby the internal lining of the uterus grows outside, It's supposed to be inside, but if it grows on the outside, on the surface or in the cyst, it's nothing good. So the cramps is very bad, or they bleed a lot. Okay, that one is related because eventually it might affect fertility and also urination. Because when that happens, when all these cells are outside, every month, right, when we have menses, we bleed, it will cause inflammation. Then the end of it, right, all the organs will stuck together. Your bladder will be stuck to the uterus, and the uterus behind, right, is a rectum. You can all get stuck together. So it becomes you want to poop, you want to pee, you have menses at the same time, it's very painful. Then it can affect the fertility law. Yeah. Okay, then the next one, chronic pelvic inflammatory disease, right, is when patients get sexually transmitted disease sometimes. And most of it is very insidious. So they may not have a lot of symptoms, no. They may have some discharge only, but after a while it stops, then sometimes comes back again. Then most of the time, the females, when they have all these, what the people like to term as BV, bacterial vaginosis, right, they don't get treated because it's not very bad. But eventually, sometimes the infection spread upwards, no, can get into the fallopian tubes and ovaries. That one is very bad, lor. Eventually, it will also affect the fertility, and it's very hard to reverse. Okay, pelvic adhesions is when we do operation, we go inside, we see all the organs stuck together because of the top two conditions. And surgery become very risky at that point in time. Okay, sometimes why we do surgery, for example, endometriosis or adenomyosis, if you have heard of these terms, right? The patients, they have fertility issues. Then they got cysts or this. So the surgeons will actually go in and try to bring down the adhesion, take of the cysts out. Okay, that improve the pain control. Fertility can also improve. Oh, yeah. Then musculoskeletal causes. A lot of people don't know. They like to go for classes or this. Then the muscles there very tight. The men also, hips very tight. Then they have this pain behind. Sometimes it can be infection. Sometimes it can be just pure mechanical thing. So this mechanical pain, sometimes you need to go for physiotherapy or this. Loosen everything, it will be much better. Then it's a pelvic pain posture. Sometimes we have abnormal posture without knowing it. We see a lot at the office. Some exercise we do, like those guys especially, when they do a lot of those muscle building exercise, they become very 大只. They become very big size, the muscle very strong. Then the directional pull is wrong already. Then they have issues. Okay? Because all this, when you solve it, right, your discomfort, your problems actually resolve faster. Okay? Irritable bowel is when you go toilet immediately after food, for example. Then very pain, like you eat hot stuff. Then the gastric start to have pain. Then after that, you need to rush to the toilet. Pooping actually makes it better. That's why you irritable bowel. Interstitial cytitis, we went through it. This one is not common. Other things that are totally not so common are nerve entrapment. Sometimes, after surgery or after various reasons, right, the nerves, small nerves, all these get trapped. So they have this very weird burning sensation, at their tummy or at their thigh there. This one also not common, but if it happens, right, we have to sort it out because the nerve pain is very bad. Nerve pain sometimes at night is like burning. It's like electric shock. So this is what a lot of people don't know. All this can be actually resolved. You just need to see the right specialist for it. Okay? Then just now we discussed about interstitial cystitis. Usually they have bladder pressure, bladder pain, and then when we do a scope, right, we can actually see the whole bladder being inflamed and red. This is a real patient of mine. So you can see that there's a lot of pointer. See? When I first put in water into the bladder, it starts bleeding away already. Then all these are all the new blood vessels that are formed. There's a lot of scarring, all these. All these are very bad. This one not common at all. And for this patient, they usually cannot even hold 10-15 minutes. It's very torturous for them, Yeah. Okay, then one thing also about fertility and gynecological thing, they can have painful intercourse. If intercourse ever become very painful, right, then you have to see a gynecologist also. Because all these can actually affect everybody's health. Then the most important thing about interstitial cystitis and bladder pain is that once the bladder starts filling up, you feel the pain already. That is the most, I think, obvious symptoms that people come for. Okay? You see, to actually diagnose interstitial cystitis, the criteria is very strict. So most people, when they come, right, it's really just pure bladder pain syndrome rather than a real interstitial cystitis. This one is totally uncommon. But when patients have it, it's bad. And most of the time, they already delayed the diagnosis already. They have been having this for years already, Then it just become a very vicious cycle. It gets worse and worse, Yeah, get it treated early. Otherwise, it's a road of no return. Then, if it's so bad, right, they may even lose the bladder because it's intractable, the pain. Okay. Yep. Then for the men, right, sometimes they feel this weird pain in the scrotum, in the testes or penis. This is a very deep-seated pain, Sometimes it's at the prostate area also. Because there's, right, it's a bit of different problem. Because they have bladder pain, but most of the time it's from the prostate. It's chronic inflammation of the prostate. Then they also have frequent urination, urge to pee. This one for both male and female. So we have all these symptoms, right, then there's something going on. We have to get it treated. Because for the men, prostate itself is a problem. If it gets bigger, if it gets inflamed, right, not treated early, right, it can also lead to a lot of other issues. Then triggers. What triggers a bladder pain syndrome? Alcohol, take too spicy food or too sour food. Then I'll tell patients, stop drinking the carbonated drinks. All your Coca-Cola, even Coke Zero is not so good. Okay, don't stimulate the pain. Okay, so when you come and see us as a urologist, what we do, I'll ask you all the questions just now. It has to be a long consult. Okay, then I examine the tummy, the pelvic region. For the females, I examine the vagina. For the men, I need to examine the prostate. It's not very nice for the guys because the prostate is accessed through the anus, so they'll feel very weird. But as guys go older, they'll understand it's part of it. Not everybody will examine it, but you only do it once in a while. Okay? Then we will send off the urine test. Most importantly, you want to make sure it's not acute infection. Because if it's an acute infection, just antibiotics and will be adequate. There. Pelvic examination, check the urine. Sometimes I do run some other tests. For the men, I need to check for any risk of prostate cancer. And yeah, that's the important stuff. We'll do an ultrasound, okay, in the clinic or at the X-ray department. Sometimes we need to measure the prostate size for the guys. For the females, sometimes occasionally I do find some gynae problems, like cysts or this that they don't know about. Then we have to get it sorted out. Okay? Yes, there's an ultrasound. It's ultrasound. Okay? Once in a while, right, if the symptoms are very bad or patient got very bad bleeding, right, then I have to do a cystoscope. Cystoscope is put a thin tube inside the bladder with a camera in front. Then we'll see what's inside. As what you saw in the picture just now, the red, my poor patient who had all this real interstitial cystitis is seen through the scope. Okay, then bladder diary. Sometimes, if it's not so bad, I'll get patient to do a bladder diary. But if the patient pee every 15 minutes, then I think it's very hard for them. Every pee, right, if your pee, right, is less than 100 mils, okay, there's something seriously wrong already. So that's how we can tell. If you go to toilet every 15 minutes, your pee come out very little, then yeah, that's really quite serious really. Please go and see somebody. Okay? Other things what we do. If we suspect gynae issues, we may do an MRI sometimes. Because endometriosis is very hard to see. Okay? Then for the gynae, if endometriosis is present, it affects fertility, they'll do a laparoscopy. What we call keyhole surgery. They go in, okay, they release all the tightness, all the adhesion, take out the cyst, and try to make the patient's life a bit better. Then occasionally we need to do bladder biopsy. Like just now my patient got all the bleeding spots, all this, right? To diagnose interstitial cystitis, I need to take bladder biopsy. And then those very bad ones, I need to distend the bladder under general anesthesia for them. Then they can hold better. Also, it reduces the pain. Yeah. Then at the same time, right, when I do all these very bad procedures, right, for bad conditions, right, I may inject Botox or this to relieve the pain. I think pain control is very important. Okay? Sometimes a lot of people, very weird, they don't want to take painkiller. They tell me I don't want to take. Then of course the pain persists. You need to take a bit. At least make you functional. Well, we find out the cause and then we treat. 对症下药, find the cause and then treat it properly. Okay? Then hormone treatment, sometimes they have to see the gynae. They need to regulate the cycles. Okay? Then infection, of course, we treat antibiotics. But you shouldn't be taking non-stop courses of antibiotic. If you take a few courses and it's still not so good already, right, I think you need other kind of investigation. Physical therapy, right, sometimes I send to the physio, they will actually do stretching exercise, all this for me, so that the patients can actually get better faster. Okay? Nerve treatment, sometimes I stimulate the nerve so that the whole bladder cycle can go back to normal. Okay? Because a lot of people, the urine cycle, whole urination cycle is a bit screwed up already. They don't know when to pee, they hold their pee until they got no sensation. Then when they need to go and pee, they rush to the toilet. Then before they rush there, they all come out already. So I tell patients, don't hold until 110%. If you need to go toilet like 90%, then you slowly can find toilet already. Otherwise, it's very tough. And you only get tougher as you get older. Okay? That's why I said just now, Botox injection. If need be, right, it's so bad. Sometimes I have to give them Botox injection into the bladder to either ease the pain or to ease the urgency. Okay? What we can do to help ourselves. Maintain good posture and regular exercise. Okay? Then, ultimately, if there's no way out, we need some form of surgery. The ultimate one, of course, is cystectomy, taking out the whole bladder because life is just too unbearable for patient. But that one is very rare. We try not to do this kind of thing because life without a bladder is very tough. The urine has to come out some other way. Okay? So what we can do to help ourselves, very simple. Drink a lot of water, but don't overdrink. Got patient tell me can drink 5 liters a day. 5 liters very hard lah. 5 liters a day, I think I'll pee every 10 minutes. Cannot. Of course, the tall, big size guys, right? 3, 4 liters very good already. Patient with kidney stones, 3, 4 liters is the norm for them. Okay? Most of the time in Singapore, so hot, you can drink 2 liters, is quite good already. Okay? Then go toilet properly, go regularly. What is regular? If you drink like 1.5 to 2 liters, right? Every 2-3 hours you go toilet is quite normal. Or some patient very proud, I can hold 5 hours. Yeah lah, you hold 5 hours, but sometimes it's because your bladder got no sensation. That is also not right. Don't do that. Okay? What you can do, if you ever have a measuring jug at home, you take the used measuring jug, you don't want to even throw already. You just when you go and pee, you measure lor. So every time you go toilet, you pee 300 to 500. In anything in between is good, pass. Okay? If you pee less than like 100, then there's a real issue. And you can hold up to 600, 700, also an issue already. So don't be too much of either way lah. Don't swing to the extremes. Have infection, treat it. Some patients, they know they have infection, but they don't want to treat it. They say that, not say don't want lah. They say, never mind lah, I take my Urel, I take my don't know what drink, maybe get a bit better. But the thing is that if you persist and not treating it, sometimes right, it can even go up to the kidney, the kind of infection, then you have to stay in hospital. So don't do that also. Okay, healthy diet is good for everyone. Go exercise and plenty of sunshine. I know very hot, but we still need a bit of vitamin D, because there are a lot of studies that show that if you lack vitamin D, it's not very good for health at all. If you, nowadays we do vitamin D assay, right, blood test for patients, a lot of people are vitamin D deficient. Yeah, so try to get a bit of sunlight. If you really cannot, you need to pop supplements already. Because I always find very weird, Singapore very hot, no? Yet we are vitamin D deficient. Yeah, it's very weird, but yeah, that's a norm now. Because even for young people, it's like that. Okay? So, okay, what we can do, observe your urine color, take a look. Okay, then some people are very good. They know when they got UTI because of the smell. Okay, smell can be affected by food. So don't kanchiong if your urine smell like coffee or durian. That's okay lah. It's normal if you take it like one day before, but it's not normal if you persistently smell like durian if you don't have any durian intake. Things like that. Okay, if you smell fishy, all this, then there's some issues. Go and see a doctor. Then any discomfort during urination. Even when you pass urine, right, you feel this weird burning sensation or this cramp at the private part is also not normal for both male and female. Have to see us. Then the flow also. If you find the flow stop like that, it's also nothing. It's also not so good. Okay. Yes, sort problem out early. Otherwise, right, if it worsens, it's very tough for us to reverse the condition. Then any problem, just let the doctors know. No need to shy on the guys also. Usually the guys, they're not say anything. It's like just say lah. Nobody, we don't judge. We just treat the issues as it is. Okay, I'm good. I hope this has been beneficial. I hope everybody learned some stuff. And of course, I hope nobody has bladder pain syndrome, because it's a very difficult condition. Do you have Q&A now? If there's any question, please feel free to ask. I'm happy to answer, even simple things. Okay, very good. I hope everybody get the gist of this talk. And yes. Are you leaking urine, or do you take a lot of coffee and tea? Okay, so if you sometimes for females after delivery, right, the pelvic floor is weak. It's normal vaginal delivery, not cesarean, right? Cesarean actually quite safe in the sense that the pelvic floor is not disturbed. But if it's a normal vaginal delivery, it will be disturbed. So when it becomes loose, right, then whenever a little bit of urine, you feel it already. So you have to do some pelvic floor exercise. And pelvic floor exercise is very specific one. Okay, it's very hard to tell patient because it's not doing, you look at the pictures, it's always a Pilates picture. That one salah, no. That one is for the back and for the hips, all this. It's not really for pelvic floor exercise. Pelvic floor exercise, that part, that muscle, right, is really just at the vagina there and near the anus for the guys. So basically, when you contract correctly, when you're peeing halfway, you should be able to stop the pee. But when you're doing the exercise, it's not doing when you're peeing, no. You're doing it when you're at relax jack, watching TV, then you do your pelvic floor exercise, you squeeze. You must be squeezed correctly. If you squeeze correctly, right, you will feel as if the whole floor is lifted upwards. A lot of patients don't know, they strain, you know. They like want to bang side, they push it out. It's wrong, That one is called straining. That one is not called pelvic floor exercise. It's the other way around. Have to do a bit. If not, this condition will just get worse. Then don't take coffee. You squeeze like that. Let's say, example, this is a pelvic floor exercise. You squeeze, right? I will give discount 50%. Actually, by right, I need to do 100 times a day. But I always tell patient 50. If 50 you can make it, then you go to 100. Because you need to squeeze. But there's no way you can squeeze all 50 at one shot. Every time you squeeze like 10, then after that you take 5 already. You take break already, then do the other stuff. A few hours later, come back and do again. Because this pelvic floor muscle is the same as all our muscle. You go to the gym, you lift weight, you also cannot lift 100 times or no. Because ultimately, the muscle will go into cramp, then it doesn't work anymore. Yeah. Coffee and tea, okay, a lot of urgency. You don't want to be that situation whereby you drink kopi, then your pelvic floor not strong, then you dash to the toilet. Yeah. Coffee and tea is very common, but a lot of people don't know that as you get older, your bladder becomes more sensitive also, no? A little bit also cannot. I mean, if you want to go and drink tea with your friend, please carry on, no problem. Just make sure that you don't got people drink one whole jug of Chinese tea and don't drink water, God. Then obviously the urgency very, very bad one, no? Usually it's the guys, Yeah. So don't do that. And bubble tea also quite bad. Bubble tea, the caffeine level is quite high, no? Then your kopi O, because everybody's get sugar, just drink kopi O. Kopi O also the caffeine level very high. Yeah. Any coffee same But Starbucks I think quite weak The caffeine. I think the Chinese, the kopi one very power one The one that make you wake up immediately one is the most powerful one Yeah. Yeah, some people cannot drink, it's okay. No worries. Yeah, so drink everything in moderation That's my take on this matter. Yeah. No problem.
I regularly do intermittent fasting.
Yes.
And it means that I only drink warm water through the day.
Yes.
And so as a result, I think my pee is probably colorless. Probably the overhydration
Yeah.
aspect. And I'm just concerned, is it like, do I need to
Didn't-
do anything?
no need.
Am I losing too much salt or something to the pee? Because intermittent fasting is actually
Correct.
no foods at all.
Correct.
No solids.
I guess if you drink enough water, like I say that 2 liters, I think you're very safe. If you tell me you drink like 4 liters a day, right, they're not so good What's the problem with this clear urine thing? Is that like what she said is correct. You lose salt in the body. You drink and drink and drink until all the salts come out. Then now you may have cramps, all these, no? Things like that, simple stuff. Yeah. So sometimes you look at the blood test result, what like that That's because you lose a lot of these salts in the body. So don't worry, the colour like a little bit yellow, okay. Not so transparent. You know sometimes you got sore throat, right? You drink damn a lot of water because damn painful, right? That's when your urine become transparent, But after a while you also cannot it's not sustainable. Yeah. Any other burning question?
Okay, if not, no other questions? Okay, then thank you.
Thank you very much.
Okay, so and now we'll learn a lot about healthcare, all the health topics. So now we proceed to the lifestyle topic, where this Winnie from Color Group, she will tell us about color analysis and what kind of skin color is more suitable to what kind of color, so you know what kind of clothes will suit you better. Okay, so we'll have Winnie. Okay, your thinness is quite a popular topic now. You just get to know yourself better, what kind of color will suit you better, so you'll look good. So yeah. Okay,
here to share with you all on this very powerful tool that can empower you to embrace authenticity, your authenticity, okay, and also to exude confidence in every aspect of your life. So this is a personal color analysis. Now, if you see from the screen here, right, do you find this screen, like, pictures familiar? Have you all seen this before? Or have you all heard about color analysis? Yes. Anyone? You've done it before? Because it's actually not very new, but it's definitely new in Singapore. However, it's been around since 1980s. Okay. By a show of hand, right, just want to know, who have actually done the color analysis before? Nobody?
Is it seasonal? Is it the fall season?
Yes, correct. It is. So you have actually heard something about
Yes,
this
I'm
before.
an autumn.
Wow.
Summer autumn combination.
Correct. So actually, for this color analysis, right, if you see on social media today, if you scroll, okay, there's this phenomenon taking over, on social media, whether you see it on Instagram, YouTube, TikTok, or Xiaohongshu, okay, people are actually finding their best color. They're finding whether, they have warm undertone or a cool undertone, what colors actually, enhances, their feature and help them to complement their skin better. So we are actually we're proud to say we are one of the first to bring into Singapore. Okay, Image Consultants has always been using this. In today's digital world, right, where we use a lot of, internet to do shopping, and then, you can actually find a lot of information on the website. Using color effectively in your dressing and lifestyle can actually help you position yourself in your area of interest for personal and business success. On the other hand, I feel like, by understanding yourself even better, right, you can actually also stop wasting money buying those lipstick that actually don't suit you at all, and then you just, you like the color maybe on your friend, but when you bought it home, you feel that, hey, this color is actually not for me, and then you just place it there. So you really, avoid wasting a lot of money on clothing and makeup that is not suitable for you. Ultimately, when we look good, we feel good, and when we feel good, we can conquer anything, correct or not? Yeah? Okay? So in simple terms, color analysis is a tool to help us find colors that would be in harmony with our skin, eye, and hair color. It also enables individuals to understand which colors make them look more vibrant, radiant, and well coordinated. Now, color analysis is also known as seasonal color analysis. Yes, we categorize individuals into the 4 seasons: spring, autumn, summer, and winter. So each of the season will own its own set of colors. Okay, if you see spring, right, tell me, what do you associate with? Flowers, blooming flowers after the cold winter. Okay, the warm sun maybe. Okay, very warm. Glow, yes, pastel. Yeah. So for for spring colors, they are very bright colors. Okay, they are often associated with like blossoming flowers, and they are colors that are less saturated. So they are not like the deep colors, they are more warm, a lot of yellow tone in it. Okay, and recently there's this superstar who came to Singapore for her exclusive concert. Know who? Okay, Taylor Swift. Yes, she is actually a bright spring. So she's a spring, like with a very fair skin tone, but she's a spring color. Alright? And then in the autumn palette, if you see on my screen here, very deep colors, right? Very red, very deep, very saturated color. If you imagine spring as a fresh fruit, so imagine now a fresh yellow capsicum. When you grill it, it becomes a autumn color. Alright, so this is like the colors that is in the autumn palette. And for summer is actually a cool color. Is anyone like confused that why summer is in the cool color palette? Isn't summer related to the sunlight, very hot, right? So you imagine in the Western country, when people go for holiday, where do they go?
Beaches.
They go to the beaches, yes, correct. So at the beaches we see blue ocean, yes, correct. Blue sky, blue ocean. So that's why it is actually a cool palette.
Best choice is like
Sentosa. No, Singapore don't have the 4 seasons, only 2 seasons.
Yes.
Rain season or sunny season. Yeah. So for summer color, they are more pastel, more ash, more muted. Okay, you see a lot of like pastel color in it. And Kate Middleton, she's actually a summer color. So they are actually natural diplomats if we talk about personality. Seasonal color analysis, right, is also related to your personality traits. Okay, so that one is like another topic altogether. Today we'll give like just a very introductory of what color analysis is all about and how it can actually help you. Okay, and then winter colors, very cool, yeah, very vivid, very saturated. Their colors are very bright and very deep. So for winter palette, right, they are like the very sharp people. Yes, no. Okay, no gray areas.
Black and white.
Black and white, yes, correct. So black and white is really in this palette. Alright, a lot of Asian like us, right, we are more towards warm tone, but we do have actually Asians who are also cool tone. So we don't see just our skin tone, we'll see the undertone. Alright. So what determines our season, right? Basically we see 3 factors. Alright, the temperature. So temperature here meaning whether you have a warm undertone or cool undertone, and our undertone doesn't change until we are like 70, 80, now already older, then maybe we become paler and that actually change our undertone. Okay, the second thing we look at is the intensity of color. So whether brighter color are better for you or muted and softer colors are better. Third would be the value. So in terms of value here, we will take a look at whether your complexion suits deeper color or lighter colors. Now I want to try this exercise. This undertone, right? So undertone refers to our tone present within the skin. So there are 3 tests that we can take note of, which is the vein test. Alright. So if I can invite all of you to look at your wrist. Okay. Green means that you have a warmer undertone. Okay? And if you have a blue or purplish veins, then you have a cool undertone. And then what if you have combined color? Anyone has like a blue and green and then like a purplish? Can see? Very confused, huh? Can see? The just lighting cannot see.
You should look at it in white light or day sun.
Yeah, normal white light will be better.
Yeah.
Right, normal white light will be
So
better.
later we will go over to the other side where we have more sunlight.
More natural
you can see
lighting
the
over
vein
there.
color.
Yeah,
easier.
but actually it's very confusing to see. Even for me, being a color analyst, I don't depend on actually the veins of the customer. This afternoon, I just have one client. She has green vein, but she turned out to be summer, and summer is a cool tone. Yeah, correct. So we don't really rely entirely on actually the veins, but it can be a reference check. Okay, so usually if let's say I'm totally green, later I'll let you all see my veins. I'm totally green, and Vanessa is like purplish. Oh yeah, sorry, I have my colleague over there. I forgot to introduce her. Vanessa, so she's also from my team. Okay, she was my shiro. Alright. So the other thing that you can test is when you do jewelry test. You know, some people wear gold and they look better. Some people wear silver and they look better. So for you, like, at the back of your mind, you will definitely have a preference, correct? You feel that, I'm sure, everyone has this like, okay, I look better in silver or I look better in gold. Yeah. But many people, right, the younger one will say, no, gold is very old-fashioned. Correct? But actually sometimes, like for me, I wear gold, actually it's better. Silver, too much of contrast. There's no harmony within, my skin, everything doesn't gel all together. Okay? The other test that you guys can do is, we can do a quick test. Okay, I need you all to actually place your hand, okay, towards the screen. A bit dark. So actually, I have 2 sides. Yes, warm and cool. Okay, which one actually makes your hand look brighter? You can actually put it against white paper too, but we'll do this warm and cool. Warm, autumn, right? Okay, this one is the pink one, and then we have the green. Let's do one more time.
The skin color is important.
Sorry?
The nails tells you everything.
The nails color tell you everything.
Nail
Oh.
color.
How does it tell the undertone?
The nail color.
The nail color.
You know what nail polish are?
Yeah.
Yeah.
Right. You just see your hand.
Read the skin, right? It's nail color.
Nail colors wise, right? You mean like which color to choose, or what do you mean by? Yeah, that one actually based on season. So later,
Nail and skin same.
nail and skin.
Nail
No,
is
skin.
nail,
You
because
can you see the skin. You see your hand. You see your hand. Correct. You see your hand.
Same. Yeah.
Same.
Same. This is the same.
Okay, so if your hand constantly look brighter on the left hand side, then you may have a warm undertone. And if your hand look brighter on the other side, of course that will be a cool undertone. Alright, but this one is also just indicating. You can go back and play around, or you can even put against a white piece of paper to see whether your hand, which one is it brighter. Okay. So the next factor was intensity of colors, right? Whether you are suited for brighter, medium bright, okay, or like softer color. Can you see from this picture, which one do you think she look better in?
Number 2.
Number 2. I think from my picture, actually I think it's the screen. Is there a screen over there?
I think it's brown.
Yeah, I think this one is better. This one is a bit dark. Can we refer to the screen on the right hand side?
When you say better means what?
She look more, her feature is more enhanced. Number 1 or number 2?
Same.
About the same.
I think about the same. See, number 2 is brighter.
No, actually for my screen, right, number 1 is brighter for her. She's actually a bright winter. So she needs brighter color. This one, she actually look from my screen is more muted. Doesn't help her to bring out her best feature. Yeah.
Projection.
Correct. Yeah, I think it's So anyway, for this, right, brighter colors will also, when you put like a bright cloth around your neck, closer to your face, you can see whether the color overpower you, or does like the softer color look better. So we're going to do that actually physically later, okay, to help you to find your colors. Okay. Then the third one was value and contrast. Okay, this lady, you feel she has high contrast or low contrast? Contrast meaning you compare the hair, the skin, and the eye. Okay, does it have like a high contrast? Yes. Yeah. So for her, right, if let's say she wear very very bright and pattern color texture of clothing, she actually look better. But some people, if let's say you have a medium or lower contrast, then you can wear too complicated because people cannot see you. Yeah, the focus is you want people to see you with your best color and not see the clothes. Okay, if you all want the people to see your clothes, you wear neon color every day. Sure, got people see. Because when you walk past, they're like, oh, somebody's here. Oh, who's that? Oh, okay. All right.
So when you say contrast, because say a blonde, a very fair person
With a blonde
light
hair?
colored hair,
Then she have no contrast.
the low contrast.
Correct.
So quite typically Asians, because we are typically dark haired, dark eyed.
Yeah.
Does it mean we have high contrast?
We will see everything. Because remember there are 3 things: temperature, contrast, intensity. So all in all, right, it depends. So some people can have like the same contrast value, but their intensity of color is different. So we are all different. Yeah, we have like Asians being summer. Yeah, for the 4 seasons I have tested before. Correct. All have, like even for dark skin. Sometimes dark skin can be warm and can be cool too. So it really depends how the face actually react to the cloth that you're wearing. Okay. So why are colors important? Actually, ultimately you can wear anything that you like, but there's definitely a certain guidelines that can help you to flatter your skin, alright, rather than clash with them. So we see some examples. This lady, celebrity, Selena Gomez. Now Selena Gomez recently, we believe she actually went through some transformation in her wardrobe. Okay, which one do you think she looked better in? Left or right? Okay, make her skin more radiant. Right hand side, okay. Anyone else? Plus feature is sharper. Okay, bring out actually her undertone more. She look more vibrant. Okay, she is actually the left hand side. Yeah, correct. It's actually the left hand side. So if you see on the right, she look a little bit washed, a little bit more high contrast. Okay, she look a little bit more flush, more washed out, more drained. Okay, she look like there's no energy there. But when you look at the picture on your left, okay, she actually look more vibrant. She actually really look more vibrant. Okay. Then we see Asian celebrity.
Right.
Very good, you have very
I
good
also can become a
eyeball.
color analysis.
Oh, you also, yeah.
She looks
Can
nice
see?
in everything.
Sorry?
She looks nice in everything.
In everything. Yeah, she do look gorgeous lah.
Colour also suitable.
Correct, but for this she's a summer, so actually on cooler tone she look very harmonious. Her look is very gentle, very demure, really her personality. It brings out her true colours lah. For this right, she look a bit dull. This one, high contrast.
Yes.
Yeah, correct. So not her best. Alright, but yes, she's beautiful. Okay. Yeah. Alright, Emma Stone. Easy. This one her latest Grammy.
She's much older.
Which one do you think she look better? Right hand side. Okay, so now you all know already what to look out for. So later you all can make our job easier. You can tell us what color you are. Yes, it's actually the spring color. So Emma has actually fair skin, but she look pale in very cool color. Okay, so if she wears sage, she wears this kind of silver color, she look actually very pale. But you can see over there, right, her feature pop more in the bright spring colors. Okay, and she look very energetic, very, herself. Yeah. So this is what we
She
want.
looks older than Liu Yifei.
Very fair. I think for Westerner usually they look older.
Yeah, the age
Yeah.
faster because the environment.
Westerner, correct.
Yeah.
Okay. Kim Kardashian.
This one, the data. Left.
Left is this side, Okay. Anyone else? Agree? Left? Don't agree. Okay, yes. Kim Kardashian. So our overtone doesn't determine our undertone. Kim Kardashian is very tan, right? But she's a cool tone. So when she wear cool color, okay, it really help her to bring out her feature. But if she wear warm color, do you think she look a bit washed out? Cannot see her, right?
She looks very
flat.
faded.
Yeah, correct. Okay, so you all want to know, see more example, or do you want to do your color analysis now?
Do you have Asians as example?
Asians
More Asians will be.
more relevant.
Yeah, more
Okay.
relevant.
Asians I have Zhang Ziyi, but I have to find the pictures. Yeah, Asians I have a lot in my studio. I have a lot in studio. We couldn't do that. I think we can go do that, right? Yeah, correct. We will do it. Yeah. Yeah, correct. So thanks to the good people of PFPFA, they actually bring color analysis to you today, and we have actually stations set up already at the other side. I think you all have seen enough example. Okay, are you ready for your own color analysis? Yes? Okay? Okay.
Yeah. So anyway, before you all head over, I just want to share that thank you for joining us today. Hope you all have an enriching session. Before that, we also will have some refreshment for you all who eat. It seems that maybe some of you all are hungry by now. Also, at the end of the session, around 4:30, we will come back here for the lucky draw. Okay? Alright. Head over. Sorry, one thing that for you that came over today, right, we have a free complimentary home insurance for you all to sign up for, and we also have a free brush, like a makeup brush set if you sign up for it. Okay, we will.
The home insurance, what does it cover?
We
The fire insurance?
correct.
Oh, okay.
We will have
How many years is it?
we will have our representative to share with you.
Oh, okay.
Okay.
Sharing.
Yeah.